Hello, my name is Maddie Burton and I'm Senior Lecturer in Child and Adolescent Mental Health at the University of Worcester. I'm also a registered mental health nurse and I worked in child and adolescent mental health services both in inpatient and outpatient settings for a number of years. I'm going to talk to you today about children and young people's mental health, in particular relation to what I always refer to as the window of opportunity, because obviously children and young people spend a significant proportion of their time with yourselves, with teachers and teaching staff and school staff for a significant amount of their day. So it really is a window of opportunity in terms of being able to support children and young people that there may be concerns about over their mental health. There is an accompanying PowerPoint that goes with this talk, which has absolutely stacks and stacks of information on that might assist you in terms of further reading and access to other resources as well, as it is quite a challenge to be able to fit in the subject area into a webinar such as this one. It's really, really important, however, to think about children and young people's mental health. And whilst it's recognised that teachers are not mental health professionals, and why would they be? They shouldn't be expected to be. But it would be helpful if they did have knowledge of children and young people's mental health, so that there can be signposting and support and access to specialist services. Sort of introducing the whole idea of children and young people's mental health, it's estimated now that the figures have sadly increased, and I imagine, and we know that they will have increased as well following COVID-19 and the lockdown, which saw the closure of schools, which had a huge impact on children. So estimated that one in 8 children have a diagnosable mental health problem, and that half of all lifetime mental health problems begin to emerge by age 14. So that's what I mean by the window of opportunity in terms of recognition, access to help, access to support, can make a difference for over a whole lifetime. And mental ill health arises from a context of variables. You'll see when you have a look at the PowerPoint slides, there are some slides there about the whole debate about nature versus nurture, and you will see it demonstrated how nature is who we are, what's inside us biologically, and the nurture aspect is about social context and about what happens to us, and then as a result of that articulation, who we become psychologically emerges through the middle of that, and hopefully those PowerPoint slides will explain that more fully. And that we always think about children and young people, that we need to think about them from a developmental and a contextual perspective as well. So when we think about risk-taking behaviour, perhaps obviously that's actually part of adolescent pathology, and therefore quite normal. But it is important to recognise that children and young people do experience the same mental health problems as adults. And we're just going to focus on 2 or 3 in this webinar, because obviously there isn't time to cover the whole of them. And we will just be doing a whistle-stop tour and just touching on them to think about them. One of the most important things is about behaviour changes. So behaviour communicates something that might be going on, and if we see changes in behaviour in our pupils, it's always really, really important to be curious to think systemically. And again, that's the difference, another difference between children and young people, thinking about them in terms of mental health as opposed to adult mental health, because we always think systemically in terms of that we think about the system around the young person. And time again, you will find that you might be presented with a young person whose behaviour has changed, who is acting out, and actually there's nothing the matter with them. They are just exhibiting quite normal behaviours when you understand the context of their psychological distress because of what is going on in their environment, what is going on in their home, in their family, with their carers, etc. So, and it's really, really important. It can be really helpful as well to change our language. So instead of thinking or saying what's the matter with you, it's much more helpful to think in terms of what has happened to you, and it places a completely different sense when one talks about that, because children often feel very blamed when that sort of approach is taken. What's the matter with you? Instead, it's much more helpful to say, oh, what's happened to you, because that leads into a completely different potential conversation. And yes, it is the behaviour, and the clues are always in the behaviour. One of the most common presenting problems is anxiety. Children get very, very worried, but it just depends how much that is actually interfering in their day-to-day life, because it's really important to remember that anxiety is normal. It's what gets us out of bed in the morning, to go to work, to go to school. But when it becomes overwhelming for some children, then that is the time to seek support and look for help. And one of the things that's really important to remember is that actually high numbers of children will have experienced what you may have probably heard of, but as adverse childhood experiences. And where there has been, multiple traumatic events experienced, which will be unique to that individual, even though the child may not actually remember what they were, the experience of those traumatic events becomes located in the body as trauma. Excuse me. And then there are often things that will trigger a trauma response, and that trauma response can be quite alarming. It might mean that they need to leave the room very, very quickly. They might need to be able to get out of the class, and it's really, really important to remember, and we now know because of neuroscience and all the new emerging evidence that we have, that children's brains are constructed according to what happens to them, and sometimes the amygdala, the smoke alarm, if you like, is often on all the time in children that are in that state of high arousal all of the time, because of having experiences of being in dangerous situations like the freeze, fight, flight situation. So the slightest thing can just trip them off, and you can suddenly see quite challenging, difficult behaviours, which can sometimes be quite scary as well. But those children really, really need help and understanding, and punishment is not helpful at all. It's really, really important to to understand what might be going on for that young person, in order to appropriately support them. Other mental health conditions are self-harm and suicidal behaviour. Self-harming behaviour and suicidal behaviour, they're very, very concerning. I think sometimes in the past there's been quite, lots and lots of information about self-harm in the media, cases of self-harming becoming quite concerning, and I think it has led to almost a being quite dismissive in terms of, oh well, they're only attention seeking. It's really, really unhelpful to dismiss self-harm in that way, or describing it as attention seeking. Ultimately, it is an indicator of psychological distress, and we like to reframe. Instead of thinking about attention seeking, we think in terms of attachment seeking or attachment needing, because attachment is all about relationships, and about needing to feel secure and needing to feel safe. So it's, again, reframing language. Instead of talking about attention seeking, I mean, it is attention seeking, but why not? Why not? When you need to be attended to, you might have to resort to quite extreme behaviours to get the help and to get the support that you need. So it's always a sign of psychological distress, and it shouldn't ever be minimised. And often young people will talk about why they're doing it, but it will never ever be about the reason stated. It's always about the reason stated will be trigger factors, like perhaps a bullying incident. It's always around relationships, something that acted as a trigger, but there will always be quite a complex background behind all that, which is what we seek to take notice of and seek to understand in order to support young people. And self-harm can be considered, it's very much about coping, whereas suicidal behaviour is very much about sort of giving up. So they are on the same continuum. So those who complete suicides, very sadly, will have a self-harming history. A high percentage have a self-harming history. So it should never ever be minimised. It should always be taken really, really seriously, and steps taken in order to support the young person. Other mental health problems that you might come across are children with eating disorders. There's evidence that eating disorders are beginning at an earlier and earlier age now, and they're not to be confused with children who are fussy eaters or who only eat jam sandwiches, but it is nevertheless really, really serious when children are not eating and restricting eating, because there is that risk of developing anorexia nervosa, which is actually very, very difficult to treat if it's not caught early enough. And again, there's lots of resources and information, and I've put lots of information in the PowerPoint slides that accompany this webinar in terms of, and there's also, of course, BEAT, the Organisation for Eating Disorders, and it's always thinking, again, as I said at the outset, we always think systemically. It's about being curious, it's about thinking about the child or the young person in relation to what is going on around them at home, what has gone on before, what happened to them very, very early on. All of those elements are really, really significant in terms of understanding children and young people's mental health. One of the other important factors to think about is the having a whole school approach, in terms of, we think a lot about what we call risk and resilience factors. So risk factors in terms of the more likelihood of developing a mental health problem or not, and then resilience factors, they can mitigate risk factors. So an individual might tick lots and lots and lots and lots of risk factors, but those risk factors could be mitigated by resilience factors, and schools really have a role to play in terms of a whole school approach that is all about improving resilience, about improving self-esteem, about involving children and young people in decision making in the school setting in a real way, not just in a tokenistic way. And then also, as you will know, it's really, really important to involve families, parents, carers in thinking about the young people that are in the school setting, because all of those aspects will be resilience factors. And there is always something that all children are really, really good at, whether it's creative activities or sport. It's really, really important that they have, obviously, as you know, that they have those opportunities, because if they can develop more resilience factors and develop greater self-esteem, that will mitigate the risk factors. And you'll see in the PowerPoint slides what we mean by risk factors, and then how resilience factors can mitigate risk factors. There's much more. Fortunately, it's really good that there's a lot more understanding now in terms of thinking about a trauma-informed approach, and there's the whole Trauma-Informed Schools United Kingdom, and they offer loads of brilliant training. And again, it's just so important to come at things from a different way in terms of, what has happened to you, instead of what's the matter with you, or what's wrong with you. And schools have a really, really important part to play in all of that as well. And that, I think, probably summarises what I'm going to say for the time being. So thank you very much for listening. Thank you.